everyone, welcome back to our channel. In today's video, I'm going to talk about what medical school is like. I will divide this into two parts. In today's part, I'll talk about part 1, which is the preclinical part of medical school, and in a separate video, I'm going to talk about part 2, which is the clinical part of medical school. So I'm going to divide this video into 5 different parts to discuss preclinical years in medical school. First, I'm going to talk about the courses that you learn. Second, the exams that you take. Third, the preclinical exposure that you do get during preclinical years of medical school. 4, research experience that students typically get. And 5, extracurricular activities that students participate in. So keep in mind that every medical school is a little bit different from each other, and even within the same school, students do have different experiences. So take what I say with a grain of salt. So the preclinical part of medical school typically lasts from 18 months to about 2 years, and that depends on the school. So the traditional pathway is 2+2, which means that you have 2 years of preclinical and 2 years of clinical. However, more and more schools are now condensing the preclinical part from 2 years into 18 months. And during preclinical years, the courses that you take are typically basic science as well as clinical science. So basic science would be anything from cell and molecular biology. Here I have a big book of molecular biology of the cells, something like this. And also you would cover topics such as immunology, biochemistry, and clinical science would be the major organ system. So studying the heart, which is cardiology, studying the lungs, so pulmonology, studying the kidneys, so nephrology, and things like that. Most of the courses that you take during the first 18 months to 2 years will be lecture-based, so you would sit in a big lecture hall with all of your classmates. A lot of schools are now offering recorded lectures, so you do have the option of kind of sitting at home watching the videos at your own pace, and you can speed it up at twice the speed if you want to, or you can take a pause and take notes, and a lot of students do enjoy that option a lot. And in addition to lectures, you have this thing called TBLs, which are team-based learnings, also known as smaller precepting groups. So typically you would have about 8 to 12 students together sitting with a senior resident or an attending physician, and you will go over kind of the fundamental principles of medicine, such as the pressure volume loop if you're studying cardiology, and kind of studying the pulmonary function tests if you're in the pulmonology module. And it's very helpful to discuss these problems in a smaller setting so you can feel a lot more comfortable asking questions. And in addition to lectures and TBLs, there are also labs that students take part in. So things like gross anatomy labs, where you dissect a cadaver and really get to know the anatomy of a human body, and neurology lab, where you go through sections of a brain to study that, and pathology labs as well as microbiology labs are also some of the typical classes that would be incorporated in a medical school curriculum. Alright, so now let's talk about exams. In medical school, there are actually quite a few exams. In my school, during preclinical years, exams were every other week, so twice a month. And in college, you know, we're kind of used to studying for exams pretty intensively and prepping for them for midterms and then for finals, but then you only had to do it twice a semester. Whereas in medical school, you really do have to be very on top of the material and make sure that you're understanding everything that's going on, because there are exams every other week. With that said, the preclinical curriculum in most of the schools that I know of are actually pass or fail, which means that it's okay if you do not spend the extra 10 hours to get the additional 5 points. They really want to make sure that you are understanding the foundational principles, and you're not spending hours and hours memorizing the little details that you can probably just easily look up. Alright, so now let's talk about clinical exposure. Even though this video is called the preclinical part of medical school, most medical schools actually do try very hard to make sure that their students from day one have some kind of clinical exposure and have some kind of interaction with patients. And that's actually very helpful. That is what people come to medical school for. So, for example, they would get small groups of students together, go to patient floors, and actually learn how to do physical exams on real patients, and of course it's under very close supervision of either a senior resident or an attending physician. And that's actually, I found it to be very helpful, because when you first enter medical school, you don't exactly know what your role is, you don't know how to interact with patients, and through these kinds of experiences, you are learning how to introduce yourself, how to kind of talk to a patient, how to make sure that you're making them feel comfortable, and at the same time, you are also comfortable as well. Let's talk about research. Most students during medical school are involved in some kind of research. If not during the first year, then most people get involved during the summer between first and second year of medical school. And oftentimes the administration is very helpful in connecting students with PI to help make sure that they do find research opportunities that they're interested in. And in terms of the field of research, it doesn't have to be the field that you want to specialize in. Actually, most students, when they start out, they don't really know what they want to go into. And for those who think that they know, oftentimes they change their minds too. And there are many different kinds of research opportunities in medical school. There are basic science research, so those are typically bench research. You will work with cells, you probably would do experiments with animal models. And then if you want, you can also try to participate in clinical research, which means that you'd be screening patients, helping with patient recruitment. And then some people end up doing a combination of both, some kind of translational research, where they both work in the lab and also help out with some kind of clinical trial. Alright, so now let's talk about the fun part of medical school, all the different kinds of extracurricular activities that you can participate in. So there are a lot of student clubs, and some are more academic, some are just purely for fun. The academic clubs are things like internal medicine interest group, oncology, cardiology, surgery club. These are groups where students get together, they talk to specialists in their field, they have panel discussions, dinner lectures, they do all kinds of activities where they learn more about the specialty of their interests. And then the clubs that are more for fun are things like movie club, wine tasting club, painting club, where you're just really getting together and enjoying life together. And then in a lot of schools, they actually partner up with the free clinic, where students go and help and volunteer with attending physicians and provide comprehensive health care for pretty much all individuals that come to the clinic. And I think this is something that I would recommend people interested to participate in, because you're helping people that really need the service, and at the same time you're gaining valuable clinical experience. Alright, that's a lot of information. I hope it's helpful. In a separate video, I will talk about the next part of medical school. If you've enjoyed this video and found it to be helpful, please like, comment, and subscribe. Thank you so much for watching. See you in the next video. Goodbye.